The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank Mercy Medical Center, Studio Arts and Glass, Kiko Auctioneers and Realtors, and of course our technical producer, J.D. DeAngelis. In the studio with me today is Brad White, who happens to have his birthday today on the 15th of February.
Happy birthday, Brad.
How many years have you been on the planet, Brad? I forget.
46. Somehow.
46 years on the planet. Okay, all right. A compounding pharmacist and our very special guest, Dr. Ahmed Sabe, Executive Director of Mercy Heart Center. Good morning and welcome to the show, Doctor. And Dr. Sabe was our first guest on the program over 8 years ago.
Over 8 years ago.
Yes. Oh, amazing.
Time flies.
Time flies.
Yes.
Well, more than 5 million Americans are diagnosed with heart valve disease every year, according to the American Heart Association. When one or more of your heart valves fails to work properly, surgery is often required in order to replace that valve. Innovative procedures like Transcatheter Aortic Valve Replacement, commonly known as TAVR, can provide beneficial treatment options and faster recovery for patients who may not be considered candidates for open heart surgery. As we continue this month's focus on heart health awareness, today we're going to discuss this life-saving procedure with Dr. Sabe. We'd like to remind our listeners that today's program is also available on our podcast, which can be downloaded from the App Store on your favorite mobile phone. You can look for Health Matters with the Medicine Center Pharmacy and take our program with you anywhere you go. If you have questions you'd like addressed, you can post them up today on our live Facebook feed, or you can give us a call here at the radio station at 330-450-1480.
So, Doctor, tell us a little bit about yourself, your education, and I know you've been here a long time and have seen a lot of changes at Mercy Medical Center. So,
A lot of changes in the whole health care. Well, I'm a physician. I'm MD, and I went through the training of general medicine, general cardiology, and intervention cardiology, which actually included a structural heart disease, which now is in its own subspecialty and the training. In my training in Mass General in Harvard, it was one of the earliest and the few centers in the whole world who really dealt with the structural heart, like treating the valve disease without surgery, doing valvoplasty for the 4 valves. So it was an early exposure, and I really kept a lot of passion about it. We were very few in the whole nation who really have exposure to this kind of training. And when I left Mass General and went to Penn State University, I stayed there and I continued doing the valve intervention, the non-invasive, and this was in the early 90s. I continued at Penn State, and by the time I left Penn State, I was directing intervention cardiology. So I have 2 intervention fellows. We were training them to do the stents and heart cath, and only one, if he show interest into the structure, because it wasn't that popular, but I kept passing the torch to the next generation. And then I ended up coming to work here in Canton, Ohio. It's now more than 20 years ago. I joined the system and sisters. And when I came here, I also continued to do the minimal invasive valve surgery. I was getting cases from Akron, from south of us, because officially at that time we have, still today, NOE balloon is one of the only approved balloon to treat mitral stenosis. And only few physicians were trained to do this back in the early 90s. And they can't sell it to any hospital. So Mercy Medical Center was only one of 3 hospitals in the state of Ohio who they can buy this balloon. So I use it in our patient here. It was Cleveland Clinic and the Christ Hospital in Cincinnati. So we stayed one of the only 3 centers in the state of Ohio who were offering this treatment. It was very special here because we don't have a training program. So I did all the procedures myself. Once I left Penn State, I am not training any young fellow. So I do everything myself. So it was a special outcome because it's the same doctors does it every day, every week, all the time. I was the only one until today. I liked this very much. So when we put together the heart center at Mercy, I said, I'm going to get well-experienced doctors, and I wanted to tell you, we are not going to have a training program. Every one of you will do the same procedure every day. Every surgeon at Mercy, the least experience, about 15, 17 years operating, they do it every day, themselves from A to Z. So proud of this. But that's, you said brief. It wasn't very brief, but feel free to.
It's okay. Not a problem, okay?
All right.
So we know that Mercy Cardiac Center has some unique things about it. Tell our listeners about that.
Well, quite few actually. And let's be very truthful about it. When I moved from the teaching program, I was running an intervention program in central Pennsylvania with Penn State University. I came to Canton here to join a larger group in town. And then I went to work in hospitals, and I really was little small shocked. How come the whole world is moving that fast and we are doing this simple stuff and everybody excited about it? And the community as a whole, like, it reminded me with singing in a bathroom. Everybody sing in the bathroom like his voice and the applause and everybody, my voice is great. It was like singing in the bathroom. And I remember the CEO at that time was Jack Topoliski, great man. So I told him, seriously, it's something bother me here, that everybody excited about stuff. We have to move to the future. And the reception of Mercy was special. Seriously, because I tried to move forward in different institutions, but they yield in a very nice way. They were so open. I said, this technology is available, let's get it. And that serves the patient, because the mission is we have to offer those people who come to our door the best available. It's not fair to tell them we are the best of the best and there is within 20 miles or 30 miles a place who can offer a better service. That's not the mission. And actually, I try to avoid to get involved into advertising, to try to tell people, hey, come to us here, until we really rebuild the culture. And that's why the list of first atherectomy in Stark County, first valvoplasty in Stark County, first transcatheter in Stark County, the first pulmonary shots, I think, stent in Stark County. There is quite few first keep coming, and if you look the list, it was, and I wasn't the first one who got first to Mercy. They already have the first cath lab in a community hospital by Dr. Hofster before I came years ago. So it wasn't like something new. I give them the credit. They have the open mind, the attitude of those sisters who own this place is amazing. I respect them, but I can't say enough. They really into the mission. They wants to offer the community the best possible, and they need to be informed. So we went first, and the idea of stopping a heart attack, because we are not successful to really predict who will get a heart attack, who will not. It's still, you lower your cholesterol, you quit smoking, you do whatever, and still next morning, chest pain, I can't breathe, and between you and devastating outcome is minutes. So I said, I don't know how to prevent heart attack. And I am a cardiologist, and I see how many people die. You just mentioned the American heart number is probably growing. So I said, serving a community, there is no time for the patient here who get chest pain to pick and choose. I have to serve them best possible to stop their damage. And the idea of heart cath lab in the emergency room was totally mine. And I have to convince the board of Mercy to buy the equipment. And it wasn't easy because I wanted to be truthful. For everything you do, you have to return on investment. That's a business. Sure. And I said, I don't know. You will open the artery fast or open it later. So there is no really growth in business. So I can't say if I do it early, I am going to increase the business. So the CEO said, come present it to the board. It was an interesting story. And half of them were sisters, half of them were Columbia at that time. And I presented it. And I went out, and the actually presented for Columbia came out, and they said, Dr. Sabi, you got it. I couldn't believe it. I started by a small C-arm to prove the concept. I didn't go to... So I got the cath lab, and I started working in it. People make jokes. People were criticizing. How can he open the artery in the middle of emergency room? He will have infection and the stuff. And I presented in national meeting my data few times. It's impressive. And since 1998, with God help, I still have the world record of fastest opening the clogged artery in the whole world, probably, because United States is in the top. So we open artery as short as 4 minutes. One time I break the 4 minutes by a few seconds, but I said it will be too hard, just put it 5 minutes. It's an atomic clock, so it is true. So people come with heart attack, I can't breathe, within 5 minutes, ambulance, put in the table, opens the artery. Can I go home? Well, no, you had a heart attack. We have to keep you at least a day in the hospital. And that's amazing. That's really true.
Wow. Okay, first breaks here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
It's winter weather season, which means dry, irritated skin can be a problem. Medicine Center Pharmacy can help you stay moisturized for less. Save on our Quality Choice line of products during our buy one, get one free sale. The Quality Choice brand is the same as national brand items, but without the price tag. Stop into any Medicine Center Pharmacy and stock up on all Quality Choice products, including skincare, cold and flu remedies, feminine products, and more. Mix and match all Quality Choice and save big. Free item must be equal or lesser value. Visit MedShopRx.com for more information. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we are talking about cardiovascular health and the procedures that we need to do with Executive Director of Mercy Heart Center, Dr. Ahmed Sabi. Have a question posted on our live Facebook feed, or call us at 330-450-1480. So...
All right, Doctor. We had some actually nice comments on our promotions on Facebook before the show today, and I believe that a patient possibly that you helped commented about TAVR and that he had it and it saved his life and he couldn't be more thankful. So tell us about Transcatheter Aortic Valve Replacement and who needs it and why is it such an amazing procedure?
Right. Well, let's see how we can start. There is a problem with one of the 4 aortic valve called aortic stenosis. So if we wanted to make it, I don't know if I'm going to make it simple or complicated, but the heart has 4 chambers and 2 atria and 2 ventricles. Right side and the left side. So the right side is thinner wall and collect the blood, venous blood, unoxygenated blood from the body and go to the atrium, and the atrium pass the blood to the ventricle. And in between the atrium and the ventricle there is a valve, which is a very thin, like the cigarette paper, very, very thin, and open one way. So it passes the valve from the atrium to the ventricle. And then when the ventricle pushes unoxygenated blood to the lung, he pushes it to the pulmonary artery, which carries the blood to the lung. Also, between the ventricle and pulmonary artery, another valve called the pulmonary artery. And it faces a less pressure because the lung and moving the blood from vein does not require high power. But it's also open one way so the blood will not go backward, so it can go forward to the lung to be oxygenated. Sure. Once the blood is oxygenated, it gets back to the left side, which also has 2 chambers, atrium and the ventricle. So the blood goes back for oxygenated red blood to the left atrium, and the left atrium pass it to the left ventricle through a valve called the mitral valve, also a thin valve open one way.
So the blood coming back from the lower extremities, whatever else, is sort of like goes through a valve like a sump pump check valve.
Yes.
Goes up, closes, goes up, closes.
Right.
Would that be accurate?
Yeah, it is. The valve, when the heart contract, the valve open. When the heart relax, the valve close. Okay. Because the blood wants to come backward, the valve will stop it. So if I go from the left side, oxygenated blood, come to the left ventricle is the strongest chamber of the 4 chamber. Why? Because it's responsible about pumping the blood.
Out, yeah.
Like every day, 1,500 gallons of blood pushed by this amazing,
That is amazing.
ventricle. So the ventricle pushes the blood out to your body. So it fills the oxygenated blood to your head, to your muscles, to your brain, and it goes through the aortic valve. So the aortic valve is the last valve in the 4 valves which really control getting the blood out of the strong pump, the left ventricle pump, out to your body.
And that's the one where we have the trouble.
That's the one we are talking about.
Okay.
It's such an important valve. All of them are important, but imagine this is when the strong pump wants to get the 1,500 gallons out to your body, and this valve is hardened.
Okay.
So the blood, oxygenated blood, have a hard time try to get out to your brain, to your muscles. So you start trying to do something, you feel weak, no enough oxygen coming to your muscle, and the blood stagnate backward, so it will be in your lung, so you feel short of breath.
So we might have one leaf not functioning properly on that valve. Is that?
Well, the valve, the problem with this valve depends on how old are you.
Okay.
So if most of the people who are younger than 30 years, the valve usually congenital problem.
Okay.
Sometimes they call it unicusp, like instead of having three leaflets, it's only one. Some kids born is this way. And they wouldn't know about it until the valve start calcifying and they cannot move, and this is usually treated by surgery. When you get to the age category younger than 75, between 40 and 70, this is will be another congenital valve problem. Instead of one cusp, is 2 cusps. The normal is 3. There is some people born with only 2 cusps, bicuspid aortic valve, and this is also will start the process of calcifying early, younger age, and when it gets calcified, the ventricle pushes the blood, but the valve is stiff, cannot open, and that's we call it stenosis. The one we are talking about is elderly.
Hold that thought.
Let's hold the thought.
Okay, we got to get back to that. Okay.
Of course.
Okay. Bottom of the hour, time for the news, and thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacists can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
Are you tired of paying hundreds of dollars to find out your A1C and cholesterol levels? You don't have to do that anymore. Every month in each of our pharmacies, you can get your A1C lipid profile, which includes your cholesterol levels as well as glucose results, while you wait. A Medicine Center pharmacist will draw your blood and give you the results in just minutes. You can also get your blood pressure checked for free. Call us to find out when we'll be in the Neighborhood Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia. 330-454-8772.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
You won't want to miss this upcoming Kiko Absolute auction on Saturday, February 16th with auctioneer Bill Gill Jr. You'll find a private collection of trains including Lionel trains, a Williams 5-car passenger set, MTH Rail King engines, and other accessories. See the oil on canvas paintings from G. Trent, watercolors by George B. Sutherland, and a limited edition Ken Schmidt American Indian prints. Mark your calendar for this Saturday, February 16th at 10 a.m., located at 3201 Parkway Street Northwest in Canton. Call Bill Gill Jr. at 330-455-9357 or visit KikoAuctions.com. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today, Brad and I are talking about heart surgery with Mercy Heart Center's Dr. Ahmed Sabi. We've got a lot more to cover this morning, so let's get back to the show.
All right, Dr. Sabe, you were giving us some very interesting information about TAVR and how patients can benefit from that procedure, and we had to cut you off in the middle so we could deal with the news, because I guess the news is important. But,
of course.
So please finish your
okay,
your
let
thoughts.
me. I was talking about the aortic valve, and it's one of the 4 valves within the heart chambers. And I said this valve is through this valve it passes the blood volume to be pushed from the strong heart getting out to your body. So when this valve get hardened by calcium and the leaflets are hard to push by the blood, so the ventricle get stronger and they get thicker, get hypertrophied, so he can push harder, so he can get the blood demand to your brain and body. And he keep pushing against the resistance until he gets you into failure. So then the valve is not going to get better. As a matter of fact, it keep getting worse. And in a speed that when we see somebody who has aortic stenosis, especially degenerative in older age, we try to check echo every 6 months so we can be ahead before the heart really get into major trouble. So you get the short of breath because the blood is stagnated in your lung, and the brain, when you take a deep breath, there is blood and a little air. Brain doesn't know this. He think, I'm full of air, get me another breath, get me another breath. So you keep huffing and puffing. And also you get chest pain because the muscle of the ventricle gets thick. So the coronary artery failing will have a hard time to get the blood flow into the thick muscle. Even with coronary arteries not bad, you can get chest pain. The third major symptoms, you get dizzy. You want to stand up or try to, you feel like syncope. You feel like I'm fainting. I'm almost fainting. And there is so many other symptoms can happen with the aortic stenosis, but once we get to the major 3, the short of breath or angina or syncope, we know that bad things will happen with the next 2 to 3 years.
So you said the word echo. Now there's a test called an echocardiogram.
Absolutely.
What do you do with
it? It is
that?
the ultrasound of the heart.
Okay.
It is a simple machine has a probe. You put it on the chest with some material, and it's non-invasive. You just have like maybe most of the ladies who got pregnant, they do the ultrasound to see the baby inside the uterus. It is the same idea.
Now, what does that tell the cardiologist?
It will tell the cardiologist everything he wants to know about the aortic valve. We can very much make all the decisions by the good echo Doppler ultrasound.
Okay. That's interesting. It's not invasive.
It's very simple, non-invasive, and it really tells us a lot about the heart.
It's amazing.
Yeah.
Okay, so it is possible to have a damaged or diseased aortic valve and not have any signs or symptoms.
Right. Because the heart will have his own compensatory mechanism. So when the valve get hardened, cannot open, the heart get thicker and push harder, so you will still have no symptoms, but there is a load in your heart.
Now you said earlier that the flaps in a heart valve could be 4 or more?
Well, it's 3. In the aortic valve, it's 3 leaflets.
Okay.
Very thin, pliable, move easy.
That is nuts, isn't it?
And when they get diseased by whatever it is, it used to be rheumatic fever. Years ago in the 40s, it was in United States quite epidemic. And it's now in the third world, there is still aortic valve disease from rheumatic. But the etiology is congenital or rheumatic, or most common now is degenerative disease when you get older. The same process which fill your coronary arteries with cholesterol and the calcium, inflammation and the reaction, and the calcium in the sitting on the valve, so it doesn't move very well. Also, there is some people who get radiation therapy for their chest, can get hardening of the valve. That's a very small category, but that's about the most etiologies, infectious or degenerative.
Does a new valve have more flaps?
The valve we replace in TAVR, the TAVR is essentially I use your groin or any of the arteries to get back to the aorta and to go through the calcific valve and do the balloon I used to do since 1988 to open the valve, crack the calcium open, and then put another balloon with a valve crimped on it, and then inflate the balloon so the new valve will take over the old valve. So push it to the wall with a stent, and in the middle of this stent 3 leaflet, exactly like your own. It's coming from the pericardium of the buffalo.
I guess what I thought from what we heard from the other cardiologist was that you pushed it aside, but now you're saying you go right up the middle.
Right, in the middle.
And it opens on.
Yeah, it is really not a big deal, because the aorta is a big artery, and it's not uncommon to have some calcium in the aorta, some thickening on the wall. So this will add a little bit to the wall. So it will be pushed as part of the wall. And the new valve will take over and function. So now a nice pliable valve, the heart will have an easy time again, squeeze, get all the blood to your brain, to your muscle, short of breath goes away, you feel stronger. And all those, I have quite few of my patients. It's fun to see this lady 66 or this person 90 or 81 coming to me feeling I have no more short of breath. I said, can you do more? She tell me, yeah, but my joints will not. So it's different story now.
Well, now you put that new valve inside the old valve.
Yes.
How do you seal it?
Well, it's a stent. It's like when you do stent inside the coronaries. You don't seal it. You go inside it and push the stent to the wall.
So actually what you're doing is you're flattening out all the other tissue.
And embedded in the wall.
And maybe even some cholesterol or whatever else is hanging around there. That'd be right?
Chromium cobalt. There is a metal into the stent outside the valve who will get anchored and embedded to the wall of the artery.
All right.
It's very hard to move. It's impossible.
Sure.
And very shortly, the body will heal over it, so it's part of the wall.
Okay. I see now. I just thought, okay, you got all these little cracks around the new thing, and it's leaking around the new valve. Not true.
Well, in the initial, because the first implanted valve in human was done 2002. By Alan Kerpier. It's in Europe, and it was a big revolution. By the time it starts to come here, I think Europe approved it 2007, United States 11 or 13. So there was quite like growing pain, because there was leakage around the valve, and they said, well, the surgeon always sutures the valve. The surgeon, what he does, he opens the chest, get inside, cleans the old valve, puts the new valve with a ring too, and sutures the ring to the wall. Yeah. So there is no leakage. He can't finish his surgery if there is any leakage around it.
Yeah.
In the early experience, there was some leakage around it. Today, it's a very minimum. When they find out the leakage, really people can affect their prognosis.
So back then, it was a blood transfusion issue and all that sort of thing.
We usually don't have any blood transfusion.
No transfusions. Okay.
Yeah, we today when we do the valve, actually it's for the last 3 years, I plan the valve to be same day procedure. So my patient will come in the morning, and we don't intubate, we don't put under general anesthesia. Right. I will be talking to them, hey, are you okay? Take deep breaths in and out. You may feel fainting a little bit, and they relax them. I go through the groin, I put the valve, and then close the groin, and then by the end of the day, you feeling okay? Yeah, you want to go home? Yeah, you can. And I'm sending people same day. She goes to the hospital in the morning, and they come, have a new valve, and she does all right. Of course, I watch if there is any, like sometimes you push in a conduction, so some people get some heart block. So if they needed some pacemaker or something, it's not common. It's very rare. And some people, doctor, can I stay here because it's? I said, yeah, next morning. So it's like routine. I don't intubate anymore. Majority of my patients for 3 years now. So it is becoming so simple. No blood transfusion, nothing. It is really a great option started for the patient who don't have surgical option. But now you can have a surgical option and opt to go for the TAVR.
Gosh. Okay, you're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Are you sick and tired of waiting at the big chain pharmacies for your prescription? We've all been there. You aren't feeling well, and you go to pick up your prescription, you're told to come back later. At the Medicine Center Pharmacy, you don't have to wait. We can fill your prescription in 15 minutes or less, and we could even save you some money on your prescriptions. Talk to your Medicine Center pharmacist at any one of our locations in Canton, Louisville, Minerva, and New Philadelphia. Visit medshoprx.com for more information.
Hi, this is Brad White, your Medicine Center pharmacist. Are you paying big bucks for a little blue Viagra pill? There's a better alternative. Starting at only $4 per dose with a prescription from your doctor, the Medicine Center Pharmacy can prepare a sildenafil or tadalafil tablet that melts in your mouth for an affordable price. This allows you to take care of business and still have money left over for dinner and a movie. The Medicine Center Pharmacy has 4 locations in Stark and Tuscarawas counties. We're here to keep you healthy and save you money. Give us a call at 330-339-4466 for more information.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
It's winter weather season, which means dry, irritated skin can be a problem. Medicine Center Pharmacy can help you stay moisturized for less. Save on our Quality Choice line of products during our buy one, get one free sale. The Quality Choice brand is the same as national brand items, but without the price tag. Stop into any Medicine Center Pharmacy and stock up on all Quality Choice products, including skincare, cold and flu remedies, feminine products, and more. Mix and match all Quality Choice and save big. Free item must be equal or lesser value. Visit MedShopRx.com for more information. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Today we're discussing heart surgery options, recovery, and more with Mercy Heart Center Executive Director, Dr. Ahmed Sabi. Let's get back to the last segment of the show.
All right, Doctor, I think we'd be remiss not to touch on a free community event that Mercy's having. It sounds like you're going to help us all learn how to do some heart-healthy cooking and take care of the ticker, so that we can be in a better position. Can you comment on what Mercy's doing for their program?
Well, yes, in Wednesday, February 20th, at Mercy Hall Auditorium, our hospital main campus, they will open doors at noon, and the event will include heart healthy presentation by Mercy dietitians, a cooking demonstration by our hospital executive chief, testing, receipts, and a special giveaway item. I had to read this because, seriously, I was aware of it, but I never had time to attend it. So it's very good. So I came here on Friday to find out about it. That's great. So it's great for prevention. We try to prevent a disease. By the way, high cholesterol is a risk factor for aortic sclerosis if you are old. But when we try to use a statin, didn't work really very well. So it keep getting worse no matter what, the aortic stenosis at a certain age. Just by the way.
So diet matters.
Oh, it matters a lot for coronary artery disease. Balanced diet, what to eat, it's really important. You know, we are not very good at it. None of us is very good at it. And the science beyond it is we really depend on dietitian. We need, because I told you, the amount of knowledge doubled every 3 to 4 months. So how can we keep up with this? So it's good to find the specialists who make their living studying diet to teach us what to eat.
So I noticed you're drinking coffee today, so that must be good for you.
It is
I love it too.
And every study came out, coffee was amazing.
I know.
So I survive with this nice thing. I don't drink anything, no alcohol, nothing. Yeah, sure. I'm always awake. That's why they have my pager. Dr. Sabi, we need you. I said, call me anytime. If I am not on call, I will come. Even if I am on, seriously, I'm always awake. I love to stop heart attack. It's my enemy.
Yeah.
All right.
Wow.
All right, well, how about I mention here that if you want to make a reservation to attend this free cooking demonstration, you can give Mercy Healthcare Connection a call at 330-489-1333 or toll free at 1-800-223-8662. So it's exciting to know that Mercy has both cutting-edge heart surgical care and education to complement both benefits for cardiology.
Preventive medicine, I really was. I just heard it recently from Sister Judith, who runs the whole system. She always say, community, preventive medicine. What is the strategy for protecting people from heart disease? They have an amazing passion to really serve whatever communities they come to.
How about vaping? Okay, here we got all this monstrous amount of advertising on radio, TV, everywhere. Okay, I'll switch from cigarettes to vaping, okay, because it's healthier or something. I don't know. But I just, you see these people, the car window open, cloud of smoke coming out of the car.
I know, it's really, it's truthfully, life taught me I can't judge people without being in their own shoes. I will never really. So when I talk to somebody who smoke, I tell him, if I was in your shoes, I will be smoker too. So when you want to change something habit, don't just focus on it. See what else is stressing you in your life to push you to do this. It's time to understand, because we are all human. We are so different. God created us so different, identity. So I can't feel for you. So I get to my patient, I tell him, everything you do, if I am in your shoes, I will do too. So figure how to change. You don't just focus because, oh, it's a great guy, he quit smoking, he never smoked. Not really. He was in a different shoes than yours. So figure what to do with your life. It's a multiple elements. It's not a simple thing. It's not that easy. So really, there's no reason to be dependent on things like this. Just to get to what God wants us to do, just to get to the nature stuff, get yourself busy. Make use of your talent so you can feel good. The time of giving everybody trophy, even if they lose, I am not sure. You have to be rewarded for excellence. Yeah. And that's what we are moving into Mercy Heart Hospital. No competence anymore. Competence is enough. I said no. From competence to excellence in sophisticated work, this is a long way. We are going to accept excellence now. No more competence.
I'll tell you what, Doctor, we got about a minute and a half left. Tell us more.
What do you want me to tell you?
Okay.
Yeah, in a minute and a half, I can tell you.
Whenever we have a cardiologist on the program, and you're very special, we never get through the schedule. I mean,
it's okay. The one thing I am proud of in the Stark County is the amazing group of heart doctors and the surgeon I put together. I put a dream team at Mercy. John Perry is a surgeon. Everybody knows him. Dr. Tawil, who saw him, master of vascular and the heart surgeon. Yeah. Every surgeon has experienced at least 15 to 20 years. Dr. Liku, a new addition to ours. Yeah. And the famous name, the legend Dr. Hirsch and Dr. Shamugan, Dr. Brian Siemens and Dr. Patel. There is Semenita Jones, Harvard Medical School, and she was in California in this famous college, Stanford. Yes.
Yeah. Okay.
I had dream team. Dr. Bipoli, who's like a walking textbook of the whole medicine. I am so proud. I put amazing team in the Stark County.
Absolutely dead out of time.
Absolutely. You will give me a minute. And that's really the one I'm so proud of those guys.
Thank you for a very special guest today, Dr. Ahmed Sabi, Executive Director of Mercy Heart Center. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center, Studio Arts and Glass, Kiko Auctioneers and Realtors, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.